Hi, everybody. This is a recording that for effectively I'm lecturing it today, but this is for today's lecture on the 23rd. Uh, pardon me. And I'll pick up where we left off. Just give me a second. And here we are. This is it. Basically, I'm going to start talking about the skin diseases. I'm going to use our textbook, the Cowan textbook, for the time. They arrange things differently. In the Nestor textbook, they do it by either viruses or bacteria. Here, they do it by the Cowan's way of classifying skin diseases is by a lot by their appearance and the nature of the rash that affects them. So when you hear about maculopapular, macules are flat like a freckle. Papules are slightly raised like a little bump. Okay. And so, what a lot of people will define when you describe a rash, they'll say, "Oh, this is a maculopapular rash." So it's flat, either flat or flat with little bumps. Basically, what they say. And the highlight disease certainly is measles, uh, German measles or rubella fall into this category. We'll talk about fifth disease. We'll talk about roseola. These are all relatively common, and they certainly were all extraordinarily common before we had the MMR vaccine. That was measles, mumps, and rubella. Mumps is just a quick word on mumps because I don't think we'll get around to covering it. Mumps basically is interesting a disease because you inhale. It's a paramyxovirus that you inhale, and it's a comparatively mild disease in children. It's unpleasant for a few days, and then what it does is it's classified as gastrointestinal because it affects salivary glands. Salivary glands kind of swell up. They get kids, toddlers, young, and typically what affects maybe under 10 years old get really chubby cheeks and they're very unhappy, and really it's comparatively mild. The problem is just going forward and why it's included as part of the measles, mumps, and rubella, other than the fact that in adults it's nasty is really the reason. And the older that you get, the nastier it gets. Then the inflammatory reaction. And remember, most viral diseases, whether it's skin, whether it's respiratory, whatever it affects, has to do with immunological system activity. And what happens in mumps, which is really odd, it seems to affect glands, not just the salivary glands, but other glandular structures, particularly in men, where it causes testicular inflammation because effectively the gonads are a gland, both an endocrine and an exocrine gland. Okay, and many of you will learn this when we get to repro, and we're getting to that probably next week. So it really is nasty in that regard and can really impact infertility. We used to think it was just men, but basically in women. So adult mumps is nasty. So just a quick word on that. And again, it seems to be the action of the immune system causing a lot of these problems. They describe it here pretty well. It's not a bad PowerPoint sequence. I like the way they do it. I'd like a combination of viruses and bacteria for description because now hey, with nothing else, this measles outbreak tells you guys can run into it, immunized or not, because a lot of people, this is that vaccination laxity. I know vaccines are controversial. I know I'm more than happy to spiel about controversial aspects of vaccines and problems associated with it, but the MMR vaccine's been around for a long time. Measles, this stupidity, and people will nobody ever died from measles, and I'll say it again, and I'll say it umpteenth time. The third largest killer in sub-Saharan Africa. The reason people in the United States don't die in droves from measles, and there have been a couple of fatalities with this outbreak, might I add, has a lot to do with one, health, two, nutrition, living conditions, and the ability to do it. I've told you this before. What our moms did when we all got the measles, and we all got the measles, they threatened us with bodily harm additional if we didn't lay in bed and do nothing. And basically, they said, "You got to lay in bed and watch TV." Oh boy, here's a problem. Some little kids wanted to be active. To me, that was really, I get to do this and I don't get yelled at for this. This is a good thing. So basically, rest, fluid, supportive care is all you need for most cases. There are some extraordinary circumstances, but the availability of nutrition and rest and medical care, which a lot of cultures cannot afford, really created an erroneous opinion, uh, because they only saw measles in the United States, not worldwide. So maculopapular, there's a lot of things that cause little bumps, all sorts of them. We'll look at some fungal infections. They're in this. Also, we look at this a little bit later in this particular book, but they fall into this category. That's part of what we call a differential diagnosis. The ability to see what it is, and if you see measles, you would never forget it. The Nestor PowerPoint used to have a very good picture of measles. Hopefully, we'll find it somewhere here in Cowan's PowerPoint. If not, I'll be easily available online. I mean, it's just though somebody took, because particularly it tends to start facially more than anywhere else, facially, upper torso, but particularly facially, with a very high fever, and it's unmistakable. And you would see as though somebody splattered red paint. The name of it is, the official name is called rubeola back in the old days. Rubeola because it was ruby red, if you can imagine that distinct red color that was there. Rubella because it was paler, and roseola because it was more rose color. We'll get to very, very shortly. But so let's start that with sort of the background. So here's the rubeola. How's that number? Then we're talking about sub-Saharan Africa. We're talking about other areas which have not got the benefit of vaccines, or there's poor nutrition, all the things I've talked about. Though sub-Saharan Africa is certainly the poster child for it. Third largest killer after malaria, HIV/AIDS, and then measles. 6 million people every year. It is not innocent. And it's the most highly respiratorily contagious virus that I can think of that's still actively present. Okay. And it just, depending on the author you read, 95 to 99% of us got the measles. Okay. Every year, notice it's increasing. That's vaccine laxity. Massive measles epidemic. This is in 2019. Look what's happening now. 5,600 cases. Population 2,000. 5,600 cases of measles, 81 deaths. It is staggering how important it is. It's just like you're covered. Oops. Tougher to do this at home than in where I am. All there's what the skin looks like. That's just one area, maybe wherever that's located. Sore throat, cough, head, you feel miserable. This is typical. I mean, it's immunological. So, I mean, you can understand how some of these viruses will get into structures surrounding the skin. It can lead in sort of indirectly to conjunctivitis, swollen glands, as lymphadenitis, fever. I'm at 102 to 104 in the mouth. This is one of the reasons doctors look at the mouth. Mouth is very reflective for systemic diseases. They were called Koplik's spots. They were like almost like coarse salt granular lesions adjacent to the molars on the interior of the cheek. And here's this red maculopapular. Exanthem is a fancy name for these eruptions on the head, progresses to trunk and extremities. Where the rash starts is a big deal. Okay. This one is characterized by that. Every mom in our day and age grew up knew this. These are, and really, these are complications. Laryngitis, comparatively mild, that's going to go away. But pneumonia, people don't realize how much immunologically that it comes to this. And the fact what you do is it's itchy and sore. And what we do with anything that's itchy and sore, what do? We scratch it. And when we scratch things, they get secondarily infected. Here, these are bacterial infections just because of the amount of fluid that can, with, let's say, mouth and pharyngeal secretions can get back into the ear. Here's the pneumonia. And this is, you don't see a lot of the encephalitis. This, again, is a percentage-based thing. It's just like any virus. Some people respond differently to different things. So, I mean, it's just like, I can't describe it any other. There's just some severe reactions that are unpredictable because they involve your immune system. This is occurrence 1 in less than 1,000 children getting measles pre-vaccinated. It can even happen in very rare in someone who's vaccinated. This is called, a fancy name is subacute sclerosing panencephalitis, which you don't have to know. Tragic, because they're going to die. from this. The virus itself is defective, okay, and it spreads unchecked. Blah blah blah. Profound. I mean, it's a little bit different than this kind of encephalitis. It's the subacute sclerosing panencephalitis is even worse than just and there's nothing good about encephalitis. Encephalitis, by definition, means inflammation in the brain. My daughter had viral meningitis. There's no permanent damage. The big deal when they did the MRI was to rule out encephalitis, because once the brain is inflamed, then you're going to have aspects of damage that were there. And this was viral. This was from a herpes virus, I think I told you about previously. So virus implants on the respiratory, infects the surrounding cells, travels to the lymph where it multiplies, and you get a viremia, which means it's in the bloodstream. As you can see, sometimes we'll get syncytial formation. That's a problem. Giant cells with many nuclei, that's a cluster of cells. And that's when they form like one big massive unit of cells that we call the syncytial fusion. One of the most contagious infectious diseases, humans to humans only. And you're infectious during the incubation when you don't actually see it, when the skin rash, but not during convalescence. That's the big deal. When our moms took us to the circus, I told you that anecdote. Bingo, we all got this. Measles came first, then the chicken pox. Lovely us. There's different ways to it. Basically, the diagnosis is clinical. You see what it looks like, you'd be pretty sure. Yeah, these days you would be testing and doing these various types of tests to prove it. Again, they have no idea that, again, viruses are not live, but I digress. Yeah, and it's a lot of times these days the recommendation, I know I'm not sure, but it used to be you had to get a measles booster. I don't recall having to get it because I had the disease pretty severely. As you can see, taking a look at this and looking at this, these immunizations, okay, again, have been very satisfactory. I'm not going to complain or challenge them at all. Once you get that 12 to 15 months, I think it becomes pretty unlikely that the preservatives, because the nervous system is really starting to function by that time. It's developed sufficiently, I think, to avoid problems. That's my opinion. And all of this fluid, this is it. Plenty of fluids, rest in bed, symptomatic care, cough medicines, etc., etc. All of these types of things that are there. You're talking about vitamin A supplements. I was unaware of that, but that's fine. All good. Next, we call it rubella. Sometimes, and measles was often called the 7-day measles. These are called the 3-day measles, German measles. And the name, as you can see, for they're small, rubella, little and red, not quite the same, not as large. And to my own experience, having had it, you hardly know you have it. It's very, very mild. Why are we getting immunizations for that? Because of the potential damage and spread to the unborn child. Okay, we're not even talking about it. It is tragic what we saw, and I'm sure I spoke about it before, but I'll keep talking about it. Relatively minor rash disease, few complications. This is the big player. Absolutely vital to have been vaccinated before they plan to conceive. As I told you, this is, you didn't know you were spreading it. Very, very pale colored, face and onto the extremities, couple of days, low grade fever, 100. I didn't know it and went to school. I mean, did I get yelled at by this one girl who we were in driver's ed? And oh my God, little did I know her sister was pregnant, and boy, did I get screamed at, and oh boy, was she absolutely right. I wish I knew. So these are all parts of that type of thing. Why am I getting little BBs here? I don't know. I'm looking to see if anybody wants me. Sorry, guys. All of those types of things that were there. and it's very, very much milder. Uh, you just feel sore and sick, and I was better in a couple of days. It's basically the best way I can explain it to you. This is the problem. A definition of a teratogen is absolutely what we see. A teratogen means it will harm the unborn child, and it's extraordinarily easy to occur because of the period of time that's involved with the contagion. I'm trying to think. They have that in this PowerPoint. So, mother to fetus in utero, first trimester, permanent defects. This is the reason why in our day and age, kids had, before the MMR vaccine, kids had hearing aids, kids had speech defects. Every class had kids who were going to speech therapy or had hearing aids, just the way it was. It was part of normal. And the kids are horrible to each other, not realizing that this was almost unavoidable because it's such a contagious disease. Deafness. There are other things that occur in all of these things, but just awful. Okay. And then there's other times with, but really to me, the hearing, nervous system was principally affected. Again, it's a toga virus, which is original family, stops mitosis, which is what the embryo and the fetus do, apoptosis of normal cells, vascular endothelium, poor development, and it's horrible. This is the problem. Even occasionally urine, but it's typically respiratory secretions. Okay. It's read through the prodromal phase and up to a week after, so you are contagious well before you know it and well after you think you're better. And people did not understand that. Oh, the kid's fine, just got a cold. Or they got over that stupid German measles, and out they go, and they can easily infect somebody else or come into contact and somebody in first trimester. People don't know they're pregnant. We didn't have the luxury those days. People had suspicion, but there was no such thing as an early pregnancy test. That's relatively recent. I know I'm considerably older, but this is just the way it was. Contagious for a much longer time. Virus is only moderately communicable, close living, because it's somebody you're in close contact with. Okay. As you can see, eliminated the U.S. in 2004 and from the Americas in 2015 because of this immunization. Watch out. It doesn't mean it's not going to come back. Okay. Again, as you can see, if you're going to have to make the diagnosis, there's specific testing. We have the vaccine. Okay. You can't really do much. Here's a couple one. All my kids had all of these. Erythema infectiosum, which is so infection. Fifth disease, I commented on before when we looked at viruses. It's called slap cheek syndrome. That's just what it looks like. The kids have red cheeks like that. It's relatively minor. It was named that way because of this numbering system. Because scarlet fever, measles, rubella, and another rash thought to be distinct, they didn't know that one was bacteria or one was viral or whatever, so they just put the numbers in. This was fifth, and you're going to see that roseola was sixth, often called sixth disease. So relatively mild. My kids had it. They have a low-grade fever. It does spread, then it goes away. Uh, Not a whole lot. And kids are active, so it becomes more significant. You take them to the doctor, and they go, "Hey, it's fifth disease. Remember, it's a parvovirus, as you can see here." And again, it's mostly more clinical than anything else to ruling out. If they had the MMR, then you know basically what it is. Very contagious, very mild. Important historically, not so much historically, important for you to recognize because whether you see it clinically or you see it in your family, you'll know what it is. And the same is true for roseola. Roseola is scarier because the fever is much higher. Okay. Sixth disease, because it was right after fifth disease in terms of frequency, maculopapular. Lots of them refer to it, not all of them. Proceed, not refer to this rash stage. All ones I saw did. High fever, and you're, oh my God, this poor kid's getting sick. And again, the color of the thing, the rosy color of it. And that high fever is what really gets you worried. And then, boom, it disappears. And then typically the fever disappears and the rash appears. And this happened to my kids. And it was more abdomen, chest, and trunk. So it was more to me chest, abdomen, what we saw. And then obviously then you see the trunk and it's like, oh, and because it's not on the face, that's the distinction vis-a-vis measles. And it goes away. What's interesting, and we talked about this, HHV6, latent indefinitely, can reactivate like any event, like it's a herpes virus, it's latent. This is in 100% of the US population. And the other thing is this interesting relationship in certain individuals. I do not know what the clinical criteria is or how, or have read any recent articles about this, is this interesting relationship potentially with MS. Given that we're all exposed to it, we wonder if there is a viral underpinning of multiple sclerosis. And again, there's no way to treat this. And then impetigo is a little bit different. It because it's flat, but in this case, there's more drainage. All these other ones I'm talking about only drain if somebody scratches them. And impetigo is sort of was the go-to. Pardon me, I'm gonna cough. Back when I was a kid, a lot of kids seem to have it. Little kids because of such close contact. And what happens is it gets inflamed, and the distinction between this being looking like a cold sore, because very frequently we would see it close to the lips and the mouth. The difference between like a cold sore will start not on skin, but on lining tissue like the cheeks, gums, or lips. Impetigo starts on skin. And what happens and for whatever reason, it produces typically like I hate to say plasma, but like a seepage that becomes sort of gold and crusty in appearance. Very interesting. And the two big players are the two big skin disease players from bacteria, Staphylococcus aureus and Streptococcus pyogenes. And as you can see, it's a mixture. So Strep pyogenes begins most cases, but later Staph aureus takes over. And interestingly, that destroys the Streptococcus pyogenes. The big problem when the streptococcal predominates and the Staph aureus doesn't interfere with it, then you see a very remarkable amount of complications, particularly involving the kidney and particularly called acute glomerulonephritis. The glomeruli, which we're going to cover in A&P for many of you, and I'm probably my dictation from today on A&P is going to be about that, are where all the filtration occurs. And effectively, they get blocked by antigen antibody complexes. Remember, it's an immunological phenomenon. Streptococcus, our bodies respond to immunologically. It's interesting. It's an oddball where viruses is usually the immune system is the culprit. In Streptococcus, the immune system is also the culprit. And it's a good illustration because you start seeing that sort of honey or golden crust, and boy, that's a tell. That's an indicator. And as you can see, mouth, face, yeah, it can be on the extremities. I mean, and the big problem is in most of these is this acute glomerulonephritis, and the kidneys shut down. Again, my stepson had it. It was from a strep throat. I think it's more common from the skin. Now, in Staphylococcus aureus, there's exfoliating toxins. There's a famous one. We'll see this, if not in this or in the other PowerPoint, called scalded skin syndrome. Staphylococcus produces a toxin that will cause the outer layer of the skin sort of to separate at the dermal epidermal junction. In other words, make blisters. And it can be really nasty, particularly in infants. But this is sort of a variant of that by these exfoliating toxins. When it's strep, and that's part of it's what makes it nasty. And again, you can get additional infections on damaged skin. Strep pyogenes, again, beta hemolytic, blood auger, streptococcal pharyngitis, scarlet fever, pneumonia, that's childbirth fever, that's flesh-eating disease, bloodstream infections, all of these post-streptococcal immunological conditions we talked about, rheumatic fever, and glomerulonephritis, they're all part of that. That's why those have to be treated, and they have to be treated with antibiotics. And most of the time, assuming they're not allergic to penicillin, typically a cephalosporin is all you have to do, and you do not have any more problems. Okay, if it's MRSA, you have to adapt accordingly. So, impetigo biologies can be followed by acute post-streptococcal glomerulonephritis. I don't know if it's that rarely. I mean, everybody's opinion is different. Maybe statistically, it's more from strep throat, but strep throats are more common. So I think that's at least worth talking about. Or remembering the possibility. I think you absolutely should, because you'll be on the test about glomerulonephritis. Okay, impetigo not related to rheumatic fever. Those are the strep throat ones. More often, the cause in newborn Staph aureus is cause of impetigo in older children. Okay. You can see, but they can overlap. That was a very good section on that particular disease. Streptococcal infections, because of those spreading factors, this is something we used to see a lot of. Remember, we had in a hospital, we had a relatively indigent population, uh, a lot of homeless individuals, a lot of very poor individuals. We worked in a very uh, poor section of Philadelphia in the inner city. Best way to describe it in North Philly. We got these periodically in the hospital. And the treatment then was massive doses of intravenous penicillin. Again, assuming they weren't allergic to it. It was almost like a sore started. They scratched it. Maybe it was a cut. Maybe it's and there it could easily be a bug bite or something like that. I mean, these are homeless individuals sleeping on the street, sleeping in bad places, even flop houses. And again, these are 50 cent a night beds. You know, more or less. And what would happen is they would start to get a rash. It looked like, but it was red and hot and swollen, and it would ascend. It would be going toward the heart, mostly in the lower extremity, but it could be from the upper extremity. Fever and swelling, lymph nodes, red lines. That's lymphangitis. We used to call it blood poisoning, but actually it's lymphatics, microbes and bacteremia. Okay, if it's not, as long as it's not complicated, and we were fortunate. I mean, these were people, but if you got them fast enough, we hit them with heavy duty doses of penicillin, and it worked very, very effectively. So most often, if Streptococcus pyogenes, again, it could be anything, different kinds of streptococci. Okay, trauma, no obvious breaks in the skin. Interestingly enough, I had, it happens to me all the time. I actually had this happen to me from that led to about 103 fever, and yeah, I had to take the cephalosporins and all that good stuff. When I'm trying to remember, I was not sure if I was teaching an RMU, but it flared when I was at CCAC in an evening course. Came home with fever and chills. Went to the emergency room, like 103, 104 fever. And they noticed on my leg, from a leg that had been swollen because I'd had superficial phlebitis, and I probably scratched it, rubbed it. I had dry skin, whatever. Boom. Next thing you know, I had this. That's the cellulitis. Okay. Definitely clinical. Yes, you can culture it. Okay. Mine would, I guess, other than the fever, I always say mine was mild to moderate. Okay. I didn't have to intravenous. They would have put me on it if I went to the hospital. I didn't require any debridement. It wasn't a lot of, it was just a subtle redness that the physician in charge noticed. Here's a scalded skin syndrome. It's almost like the skin is peeling. Here's the epidermal dermal junction. It's it can go through a nursery and a hospital like wildfire. Okay, uh, effectively, it's all about blisters. Basically, it separates the skin and it causes a big blister. The name for a big blister is a bulla. So they call these bullous lesions around, starts here, umbilical area, diaper area, axillary area. Splits occur, as you can remember, the stratum basal, widespread with a desquamation. It's like think of second degree burns without burns, and so it has to be this. Again, they always use this acronym. Well, I would not use it in a hospital, but this is something you hear about an outbreak in a nursery in a big hospital. Very aggressive with antibiotics. Thankfully, it's usually not a MRSA. Caregivers can give it. Adults in the nursery, 30% of asymptomatic carrier harboring the organism in all these places. Okay. And so you have to just, it's almost like process of elimination. You have to be very great precautions that anybody who could be a carrier, how, and most of the time you're looking at the nose, and it would probably be culturing to see just how many they could actively cultivate Staphylococcus aureus in certain strains. I would anticipate, and yes, immediate treatment. Very nasty. And the name of that particular toxin goes by since it effectively scalds the skin and the skin peels or exfoliates. It's called exfoliatin. EXFOLIATIN. I think it's on my handout, which sort of brings us to the next. That's just sort of a transitional category. Previously, this is when we talk about vesicles. Okay, vesicles are tiny blisters. Bulla are bigger blisters, and blebs are giant blisters. Have you ever seen giant fever blisters, or we see blisters that are associated with a ton of swelling in the leg, like we call them fracture blisters? So there's all sorts of different terms that you can see. I mean, where measles would cover that whole face, chicken pox, you see little dots, and they drain. Okay, so it starts as a little blister, but then it almost matures into a pustule and dries and scabs over. Extraordinary. And this is typically a minor disease, except in certain cases it can cause life-threatening complications. And this brings back to that Reye syndrome, REYE', where we, in our day and age, we didn't have Tylenol came out in 1955. Okay, I think I got a chicken pox in 57. Most houses were still using aspirin. So we were very fortunate if they were giving us like Bear Chewy's children's aspirin, which was sort of the order of the day. If someone got you to swallow it, or mushed it up and put it in something that you're trying to eat. I'm very fortunate we didn't have more problems with this. Uh, prior to, and again, everybody with chicken pox, that was a later immunization. All of my three kids got the chicken pox in 1988. 2 weeks after one another, according to age. So my oldest brought it, and my middle one got it next, and my daughter got it next. As far as we know, smallpox was eradicated in 1977. The last case was in Somalia. Haven't seen it. Okay. They start as generalized rashes, but then the development of either the pox, and you always see these historical pictures, or maybe just these tiny pustules. So again, whether it's chickenpox, individuals contain a fluid, and typically, if they're scratched and itched, they get little pustules. So it become from a clear fluid to a pus-contained fluid. Kind of why the measles came to us first before the chickenpox has to do with the amount of incubation period. Again, usually it can be all over, but typically the facial area predominates, and you can see it sort of spreads itself out from being central to going toward the extremities. So it's more centrally placed in the torso, scalp, face, and trunk, and then out to the extremities. And they go all the way macules to papules to vesicles. And then typically the fluid is clear. They crust over, and as moms would scream at you because it's so itchy, just like the measles. I mean, that they trim your nails down until you had zero nubs because you're afraid you're going to scratch it. And with the itchiness was so severe, particularly with chickenpox, more so than measles. In my kids, we did colloidal oatmeal baths. That was an Aveeno product before Aveeno became famous for skin lines. And it worked very well. You stuffed them in the bathtub, and it was one of the few things, other than in those days, they didn't use cortisone lotions or creams. They thought that would worsen it. So we had a lot of like calamine lotion or Caladryl, things that we would typically be using on things like poison ivy. And you can see, and again, all of these, what I'm telling you about, if they happen in adults, they're worse. So this is the centripetal, more in the center. Yeah, I'd agree. 3 to 5, 4 to 7 days, about average. And the old story was once everything scabbed over, you were no longer contagious. And I still think it persists. I would be reluctant. I mean, I'd give it, once they scared it over, I'd wait probably another 24 hours before you sent the kids back to school. And you can see 0.1% cases are followed by encephalopathy. And again, inflammation of brain tissue. Okay. It could be serious damage. It's, you just don't see it that much. Okay. And now you don't see it almost not at all because of the immunization. It doesn't matter whether if you got the chickenpox shot, if you got the chickenpox, or you had neither of them, it's around. Even if it infected you and it didn't impact you, all of us have the potential to get shingles, herpes zoster. Asymmetrical distribution of a red, angry rash, and it follows the distribution of a peripheral nerve. This is where your anatomy comes in. Herpes hangs out in sensory nerve roots. It can be along the face, it can go into the scalp, it can go toward the eye. The most common place you see them is it's emanating from the torso, starting on the back and going forwards to the trunk. Okay, that's where, but they can occur absolutely anywhere. I saw cases in the scalp, I saw cases going into the eye. They are awful and it's extraordinarily painful. The biggest problem was dealing with the pain until we had antivirals like Valtrex. The biggest problem was getting the patient, not so much dealing with the pain, getting them off pain medicine. You didn't have a whole lot else you could do. Maybe you could use some steroids on it, topical steroids, and that, it was just pain control. Okay. And so this is the reemergence of the latent form. Same virus, different presentation from its initial presentation to shingles. And indeed, if someone never had or never was immunized for chickenpox and they came in contact with somebody with the shingles, the shingles are not contagious per se, but the shingles somebody would then get the chickenpox. You got to get the chickenpox to start before you can have the shingles. Okay. And the reactivation it's almost unpredictable. Any kind of stressors, any kind of immunosuppression, medications, aging, underlying disease factors, cancer. First case I saw was, and I heard this was typical. I was on a dermatology rotation. They got called up to ICU. Guy had a heart attack. Boom, out came the shingles. I said, how? They're walking up the stairs going, hey, he's got the shingles. Before they saw him, came down, he got shingles, brought it up. Everybody else in the ICU went, yeah, we figured it was a shingles, but we had to call for a derm consult. Got it. Okay. Virus resumes. Crops of tender vesicles. They're flatter than vesicles. What I have seen. They call it post-herpetic. That means after herpes infection, neuralgia. It can be tender for a long period. That's why I had real problems with pain medicine. Cranial nerves, and I saw these. People couldn't see, face problems, and it just follows what we call the dermatome because that's the distribution of the nerves. Angry. They're angrier looking than chickenpox. Okay. HHV3, varicella, VZV, varicella zoster virus. Remember, this is where they hang out, the dorsal root ganglia. They're latent. That's the big virulence factor, human to human. Respiratory droplets, even in the active, even though there's shingle sores, that's how somebody could come in contact with them if they didn't have, and again, it would be if they hadn't already received the immunization, but effectively all of us. And the reality is, one out of three of us is going to get the shingles. How effective the medicines, the Zostavax or similar immunizations are to prevent it in people, let's say over 60, I do not know. A day or two prior, you almost certainly get it. There you go. 1995. I mean, to prevent, I didn't have that immunization, and I'm not worried about it. As you can see, the chickenpox alone, not a big problem. Again, ear infections, people scratching, getting problems with the skin. the acyclovirs if necessary. Here's the Rye syndrome note. And then lastly, on smallpox, I've done this for quite a bit. The more concern is if there is some nation state harboring smallpox that they are trying to weaponize, and potentially could release that particular virus. So we have, because I was we were we got a smallpox vaccine. I mean, they improved the way the vaccine was given, and then and I don't know exactly when. So the vaccine was discontinued because the disease was eradicated. But again, there's certain populations. Would I be shocked? Because my son in the Navy, I mean, he just said he got a mountain of shots. Particularly went to Cambodia, to try to set up maneuvers with their Navy for the first time since the Vietnam War. He said, "My arms are going to fall off, Dad." And so awful looking bumps, flat, and these horrible, I mean, disfiguring. The people who survived inevitably had scars from smallpox. It's called variola major. There's also a variola minor, but if you ever see the term variola major, I won't put it on a test. But something else I might throw on a test. Remember variola? They have these interesting old names: the rubella, rubiola, variola. I don't know what the derivation is. It's all about it's variola major for smallpox, fever, rash, severe pain, spreads throughout. It's what makes it such a bioweapon. I mean, it spreads respiratorily spread. You cough, you sneeze, all of those types of things. It spreads so easily, and bang, the next thing you know, 3 to 5 days later, people are dead. Okay, third or fourth day, they begin to appear. Okay, very ill, but really, unfortunately, it has a very high fatality rate. And minor is not, so they call it a pox virus. It's we don't even say orthopox, we just say pox virus. Again, it's enveloped. Monkeypox is in there. I don't know why they're making a big deal of it. It's not the same. That's the cowpox. That's what the vaccine was based on. And it survives a long time, considering it's an enveloped virus. Uh, Droplets can be anywhere. You can see this. The numbers are sort of staggering. 2 million people died at that time. This is in the 70s. Okay. Last case Somalia, 1977. And again, there are some, now we have some of those that are there. Leishmaniasis, we're not going to do. You just don't see it. You can see it's located here, typically from breaks in the skin, and then this can get in. It's there. It is, again, sandflies related, equator. We just don't have them here. So, I mean, if you're going to a culture, you'll have to learn about it. And the cutaneous anthrax, I talked about that a little bit. And there's respiratory anthrax. This is much more common. This black, we call it a black eschar, ESCHAR. This is what happened when unfortunately, when people were sending us through the mail, and we had a couple of people die. But typically, comes from the hides of infected animals. And really, again, it was wool sorters or sheep wool sorters disease for people who worked in the old days before they wore protection, before we wore masks and gloves and and big aprons to prevent this, because those spores, if you got a little break in the skin, all of a sudden you got it. I mean, yeah, left untreated, it can spread into your lungs and then become actually contagious. It'll become almost like a respiratory form of anthrax. Okay. And again, this is high risk persons or the military. And again, same thing applies. Just don't see it a lot. They would know basically from where the person was and the work that they did and their location. If there's a problem, I don't see it much. I'll save the fungal stuff for another time. My voice is getting tired. Thank you very much. Talk to you soon. We have plenty to say this time. Bye bye.